Hello there, I'm Christopher Westfall, a Medicare insurance agent, and I have information about something happening with Medicare that you probably should know about. Today, it came out in the news that a Medicare Advantage company is being sued by using their artificial intelligence and how it actually affected a couple of patients. I've been asked this question hundreds of times in the YouTube comments on this channel. Why is it that no one ever sues over all these things happening with Medicare Advantage? I don't know why they haven't until now, but they sure as heck are now. Let's read the story. This is from Modern Healthcare, a subscription-based site that I do subscribe to. It says United Health sued over AI, Medicare Advantage denials. This is an interesting article. United Health Group faces a potential class action lawsuit. That's not just a regular lawsuit, folks. That's where everybody gets involved. Over its use of an artificial intelligence tool to allegedly deny post-acute care coverage to Medicare Advantage members. We've covered this about a dozen times, that this is what they've been doing. And you saw the testimony before the U.S. Senate that we had on this channel exclusively talking about this happening. The plaintiffs, family members of two deceased United Healthcare Medicare Advantage policyholders, filed the lawsuit Tuesday in the U.S. District Court for the District of Minnesota and aim to represent a national class of similarly affected enrollees. The lawsuit alleges that the health insurance company breached its contract with members, which resulted in unjust enrichment under federal law. The complainants also claim that United Healthcare violated state laws in more than 20 jurisdictions. United Health Group did not respond to an interview request. According to the lawsuit, United Health has used an AI tool called NHPredict to review post-acute care claims since at least September of 2019. The healthcare conglomerate Optum subsidiary acquired the software's developer, Navi Health. Have you heard that on this channel a few dozen times? Yes. Medicare Advantage members appealed less than 1% of the post-acute care denials since then. But 90% of those denials were reversed, the plaintiffs assert. 1% of the people are choosing to appeal. Why is that? Just imagine you're trying to get into a skilled nursing facility. You cannot even walk. How are you going to make appeals? How are you going to represent yourself when you go before an administrative law judge? That's why they're not appealing. And some folks would say that's just why they do it, because people are not going to appeal. Represent the plaintiffs are leading the case against Cigna about using algorithms to reject claims. The complaint alleges that the late Gene Locken and Dale Tesloff, both of Wisconsin, failed to receive appropriate coverage for care following major medical incidents. That's so sad. After a fall that resulted in a broken leg and ankle and a hospitalization in May of 2022, the then 92-year-old Locken transferred to a hospice facility on a doctor's recommendation, the complaint says. United Healthcare cut off hospice coverage 2 months later after deeming it medically unnecessary and denied an appeal. According to the plaintiffs, Locken's family spent as much as $168,000 out of pocket for him to remain at the hospice provider until his death 4 months ago. $168,000. But Medicare Advantage is free. Tesloff had a stroke at age 74 in October 2022, and United Healthcare denied to cover 20 days of nursing home care that he received, then rejected multiple appeals, the lawsuit claims. His family paid more than $70,000 as a result. Died last month. Okay. It's the same as original Medicare, they say. Everything's covered just like original Medicare, they say. Okay. How does that work in the real world? This is a letter that just came out written by a very prominent physician. As a matter of fact, this doctor is on the American Medical Association Board of Counsel and Science on Public Health, has been a member of the American Medical Association since 1988. He knows a thing or two about healthcare and public policy. His specialty is public health and general preventive medicine. Public health. He knows about healthcare policy. Let's get his opinion on the topic. If you ever wondered, what would a doctor say? If you're a doctor and what kind of care would you want to get? Here's a clue. Be smart about Medicare Advantage, he writes. Senior citizens like me are bombarded, especially in autumn, with invitations to drop their traditional Medicare. Most sales agents won't tell you this is what you're doing. They won't tell you. They'll tell you this is Part C of Medicare. It's just another part of Medicare. This is just a different way of getting your benefits. No, you drop traditional Medicare for the time in which you're on a Medicare Advantage plan. So he says, invitations to drop their traditional Medicare and sign up for so-called Medicare Advantage plans. These plans exist to solve a problem. Not your problem, the politician's problem. Medicare is one of the most efficient and beloved health insurance plans there is. That's true. But Medicare is run by government employees and contractors who don't pay significant campaign contributions to politicians. Corporate campaign contributions are really bribes for special access. Most Congress members want more of this money. The solution? Medicare Advantage. Congress allocates more money per patient for these plans and pays them based on a risk-adjusted basis. Risk-adjusted means that when the insurance company convinces the government that you are sicker, they are paid more. Medicare Advantage plans often promise extra services. Sometimes they deliver. Sometimes they don't. Medicare Advantage plans pick and choose where you can go for your health care. They can refuse to pay for any service they choose. There are rules about this, but remember, the plan is big and has a lot more money than you do. You and your doctor are small. You and your doctor have a lot less money than the insurance company. If a private health insurance company says no to something traditional Medicare would have covered, you or your doctor can appeal. But the company has all the time and money they need to wear you and your doctor out. On your next medical visit, ask whether your doctor has the time to fight all the insurance company's bad decisions. Like every salesperson, the representative of Medicare Advantage pretend to be on your side. They sure as heck do. They're not. They're paid to get you to sign away the freedoms of traditional Medicare in favor of their plan. This is not me saying it. It's a doctor saying it that specializes in public health, public policy since 1988, a member of the American Medical Association, a board member. How does the messy and often cruel Medicare Advantage system solve the politicians' problem? Big health insurance companies make a lot of campaign contributions to keep their favorable treatment coming. We just showed you yesterday how a board member on one of the insurance companies, Medicare Advantage, has been nominated by the Biden administration, recommended by Mitch McConnell, minority leader of the Senate, to be on the Medicare Board of Trustees and keep his job at Clover Health, a Medicare Advantage company. If that's not conflict of interest, I don't know what is. How does this system solve your problems? It usually doesn't, especially if you're sick. Remember what the senator said about that? Exactly that. It's good for the small stuff until you need it for the big stuff. When you're sick, traditional Medicare pays your doctors. Period. End of story. Done deal. When you're sick, Medicare Advantage programs pay your doctors if they feel like it. They usually pay less money. They hassle your doctors more. Remember where we covered the hospitals literally shutting down in 6 states because they're being paid so badly by Medicare Advantage. It goes on, if you're tempted to buy a Medicare Advantage sales pitch, please check first the government's Medicare information sheet at this link. We'll put that link in the description of the video. Remember, health insurance is valuable when you're healthy, but it's essential when you're sick. If you signed up for Medicare Advantage, and this is where we're going to go off the rails a little bit, it's like me performing surgery. The doctor's going to perform insurance here, and he says, if you signed up for Medicare Advantage and you want to drop it, you need to call your plan and also call 1-800-MEDICARE to notify the government. There are only certain times you can get back to a traditional Medicare, as outlined in this report from Kaiser Family Foundation. He doesn't talk about Medicare Supplement, which is what you should replace the Advantage plan with. So you're not exposed to 20% of an unlimited number. To do that, it's a complicated task that we could help you with if you need it. Medicare Advantage isn't corporations' only way to get your money, but it's one of the most dangerous. Be careful. Dr. 𝐀𝐝𝐿𝐼𝐬𝐿. Yeah, that's in his own words. And then there's another scam video that just came out that you need to be aware of, things that they're doing during this season. And I want you to listen to this video. And also, please share this information with somebody that you like.
Well, it is open enrollment season for Medicare, and scammers are looking to take advantage of it. Promises of cheaper insurance or better health care plans could scam you into giving up personal information. Seven's on your side with ways to help prevent you and your family from becoming a victim.
Well, scammers take advantage of whatever's in the news. You know, people know that Medicare open enrollment is happening now, so they're not surprised.
Scammers are using all forms of communications to try and get your personal information. Not only could you be flooded with calls or emails, they're also contacting you via text or by social media.
They're making calls and pretending to be from Medicare or associated with Medicare and telling people, oh, you need a new card or you need to change your insurance. And they're asking for Medicare numbers or social security numbers or payment or financial account information.
And that's a big red flag. Never give out that kind of information. Medicare will never ask you for any of that.
Medicare doesn't call and say, you need to pay me. You don't need to pay Medicare. Medicare doesn't sell you things. Medicare doesn't ask you to pay for insurance or products or say, we want to send you a DNA kit. That is not Medicare.
Yeah, protect yourself by closely examining who sent an email or a text. If you don't recognize the sender, don't click on links or download attachments. Remember, scammers may use an address similar to a government agency's to try to trick you. Don't respond to messages or calls you don't expect. And if you're unsure, contact Medicare directly. Finally, if you believe you're being scammed, notify the FTC. That will help investigators track down and stop cyber criminals.
Hello, I'm Mark Brown. Get more great ABC7 content by clicking the subscribe button.
There you have it. And let me get you over to this one. I want you to see something real quick. And it's here. There are two different ways that you can go on Medicare. And most agents out there today, God bless them, they just won't show you that there are two different ways to go on original Medicare. One way pays the agents a heck of a lot more money, and that's Medicare Advantage. That's the only one that the agents of today are typically telling anybody. So don't just go one way. You paid into Medicare your whole entire life. That's original Medicare right here. You paid into it your whole entire life. Those of us that are still working are still contributing to the Medicare Trust Fund so that you can have the original Medicare that came out in 1965. It's a good program. You can go to any doctor in any hospital, anywhere you want in America that accepts original Medicare, which is most everybody. And then you have the alternative of Medicare Advantage. What is Medicare Advantage? It is a private replacement for original Medicare. It is where a health plan is paid a set price per member per month for your care. The incentive, this is not my words, the incentive as described by the Office of Inspector General for Health and Human Services said, the incentive unfortunately is to do less in care and keep more in profit. That's just a fact. So that's the difference, Medicare Advantage versus Medicare Supplement. Now on Medicare Advantage, they're going to have all kinds of freebies. They're going to give you things like free dental. Look at how comprehensive that is. And the YMCA. And we just had that lady call the other day and she begged 4 times, please help me get off of this plan. I lost my Medicare because I wanted the YMCA. That's not a real reason to give up your Medicare. So does Medicare cover the same, does Medicare Advantage cover the same thing as original Medicare? Does it cover the exact same thing? If you had a supplement and you're trying to go to skilled nursing, are you going to have the same treatment up to 100 days, it says in the Medicare and You guidebook? Are you going to get 100 days if you need it on Medicare Advantage? I don't know. Let's hear from an expert.
I don't know that it needs to clarify because it's already a rule that Medicare Advantage plans must cover the same as must provide at least the same benefits as original Medicare.
And that is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct, yes.
And a new rule is only as good as their being willing to change their real-world practices and CMS enforce those obligations, which it has been failing to do, correct?
Correct, yes.
Bait and switch plan. They bait people to come in with the promise of providing more, but in fact, many of the beneficiaries receive less, correct?
Well, I certainly wouldn't put it that way.
If a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. Now, these are not uninsured individuals. These are individuals who have chosen and paid for a Medicare product that was heavily marketed and aggressively sold to them. They're not getting the coverage that they paid for, and they're met with hurdles at every turn.
That's the difference. That's all. So on one side, you get what's already included with Medicare because you paid for it. On both sides, you have to pay for Part B. On both here and here, you have to pay for Part B of Medicare. Every single month, you have to pay for it. However, on original Medicare, you actually get Part B. What is Part B? That's where you can go to any doctor, any clinic, all your outpatient stuff, as long as it's approved by Medicare, which means it's medically necessary and you're going to a Medicare provider, which is from coast to coast, you're getting what you pay for. You're getting your Part B. If you're paying for Part B and you've opted out of original Medicare, which means that you've joined a Medicare Advantage plan, I just want you to know you're still paying for Part B, but you're not getting Part B. You can't whip out your red, white, and blue Medicare card and just go into any provider and say, you know what? Today I've decided I don't want to use that Mickey Mouse HMO. I like it because of the free dental. They give me free toothpaste down at Rite Aid, and they let me go to the YMCA. So I'll use it for that benefit. But since I don't have any specialists in my chosen need that I need to go to, like orthopedic surgery, since there's nobody good in that network, and I need a referral, and I can't even get in my primary care physician's office to get a referral because those are required on Medicare Advantage. They're not required on original Medicare. Since none of that's working for me, I'm just going to go back and use my Part B because I'm got my Part B. I just paid for it coming out of my Social Security, and here's my red, white, and blue card. It doesn't work that way, and far too few people know that when they get into a Medicare Advantage plan. They just don't know what they're giving up. So if you are on a Medicare Advantage plan and you want to change, you have 2 dates in the year that you can do that. From October 15th until December 7th, you could change. You could go back to original Medicare. That's a little bit scary because there's unlimited amount of cost available to you, which means Part B is going to cover 80% of your cost, leaving 20% of your cost. If you go into the hospital under Part A of Medicare, the good news is you can go anywhere you want to across the country if they accept original Medicare, which is just about everybody. You just walk into the hospital. If you're admitted, you're fine, or rolled in, however you get there. Over $1,600 to walk in the door for that admission. If you go back in 60 plus days later, it's another $1,638, whatever it is that year, if you're watching this later. Over $1,600 to walk in an admission on Part A of Medicare. That's why people get a Medicare supplement, also called a Medigap plan, because that fills the holes of original Medicare, and there's no decision to be made by a health plan that says, no, we're not going to pay this bill. It's automatically joined together at the hip. If your doctor says you need it, you have it. Just like that doctor just said, just like the expert, the lawyer from Wisconsin State just said. So you can leave between October 15th and December 7th, but you can also leave during this period, which is January 1st until March 31st. Please don't go do this on your own, just like the doctor said. Call your health plan, call Medicare, and say, I want to go back to original Medicare. The reason why I say this, you need to talk to a professional first. The reason why I say that is because if you do it out of order, if you drop your Medicare plan and then you go and try to get on a Medicare supplement, Medigap plan, and you don't get approved, you're stuck. You're outside of the enrollment period. You can't get back onto a plan if you've dropped one during the either one of these periods. If it's gone and it's done and you're off of it and the period's over, you're stuck. So the right way to do it is to first apply for a Medicare supplement through underwriting if required in your state, which is most states, and go to a professional who can help you go through that process. And if we can't get to you, if we can't help you before December 7th, that's okay. Why? Because we've got the other period of time, January to March 31st. And it doesn't take that much time to get an underwriting decision. So if you want help with that, great, let us help you. But whatever you do, choose somebody that didn't just start in the industry yesterday. A lot of good people that have, but I think experience matters. Just a little plug for myself at the very, very, very end here. I've been licensed for 29 years, helped thousands of people with Medicare, all the way from Virginia, Florida to Washington, California, all across this great country. So if I can help you or someone that you love that's struggling with their choices, and then we'll see what other alternatives are, please reach out. We'd be glad to do our very level best to do that. Thanks for watching. We'll keep you updated on the lawsuit. We'll keep you updated on other doctors as things are coming out about Medicare Advantage or Original Medicare, things that are changing that might impact you, which is why I say you should really subscribe to this channel. Thank you for watching. Have a wonderful day. And then I'll recommend some other videos that we might have done that might be of interest to you. They're coming up right here.